Yeah, we're pretty excited to have our next guest on. I think he brings a very deep experience, not only what they're doing at the Council for Affordable Health Coverage, but his experience on the Hill and working in Washington and talking about policy and regulation. And joining us right now is Joe White, the president of the Council for Affordable Health Coverage. Joe, good morning.
Joe, good morning. Great to be on.
Yeah, great to have you. Really appreciate you taking the time out of your schedule to join us. Give us a little bit of background and overview on what the Council's doing, what the Council's mission is, and then specifically your background, too, before we move into some of these key talking points today.
Yeah, well, the Council is actually going on our 15th anniversary this year. So we started in 2001 to enact an individual refundable advanceable tax credit to help people better afford their health coverage. If it sounds familiar, that's the key subsidy mechanism in the Affordable Care Act. And so in 2009, we wouldn't have written the subsidy the way it was written into law, but in 2009, 2010, the Council took a look at our original mission and decided that we're going to shift focus a little bit and really drill down into what's driving health cost trend, how can we empower consumers with some tools, and get some additional flexibility into the system so that employers can make better choices in terms of the coverage they offer. So the Council itself is a multi-stakeholder, Washington, D.C.-based advocacy association. We're 25 members strong, mostly employers. About 40% of our members are employers. We do have healthcare payers. We've got providers. We've got patient groups. And we're very focused on one thing, and that's bringing down the cost of healthcare for all Americans. We think that'll do the most to promote affordability. So we're focused on a couple of campaigns. Two big ones, one on transparency and another on wellness that we can get into. But all in all, what we do every day is what are the policies that Congress, the administration can enact that would lower health costs, make health coverage more affordable.
Yeah. So let's talk about that. I mean, health, talk a little bit more from your, experience on how healthcare costs have impacted employers, individuals, and taxpayers recently.
Yeah, well, it's not good news, as you could probably guess. Let's just take at a very high level. About a year ago, we had a lot of people cheerleading about the slowdown in the rate of growth in healthcare. It was historic. It was the lowest rate of growth in history. And, of course, it was slower growth, yes, and historically slow growth, yes, but off a massive base. And that growth continued to outpace both the economy and wages. So what it meant for employers was that more of what they were paying out in benefits more of what they were paying out in total compensation was going to benefits. And for an individual, they were paying more in health costs than their incomes were rising, so they were actually losing ground. What this means for an individual family, for example, for the typical family, in 2002, they paid about 17% of their income in health costs. Today, that number is 35%. In just 10 years, by 2030, that number is going to be 54% of a typical family's income. That's just not sustainable.
Yeah, you're exactly right. And so talk about federal policy that you're so involved with and how federal policy, where you are up there, has impacted an employer ability to continue to provide coverage. I mean, you're touching on some of it, but get a little deeper on what you see.
Yeah, I mean, part of the reason these costs are going up, and I'll switch to the employer side here. Premiums for family coverage for employers increased about 27% over the last 5 years. That doesn't sound like a lot, but if you think of that in terms of workers' earnings, their earnings only went up 10%. So basically, an employer is spending more and more on health coverage. One of the reasons that is because of federal health policy, not in spite of it. So the Affordable Care Act, mandated essential health benefits and mandated the actuarial values and community rating, et cetera. And those mandates have a cost, and it's increased the cost of providing coverage and doing business in a significant way. And so employers are struggling with those costs. They're struggling to report all the things they have to report under the law, all the things they've got to provide. Insurers, what we're seeing is because of the inflexibility in the Affordable Care Act, They're trying to compete on price, but what that means is very high cost sharing to the point where we've taken a look zip code by zip code. Someone in Iowa can get an unsubsidized plan for about $500 a month, but it comes with a $10,000 deductible.
Yeah.
That's not affordable coverage, right?
Right.
So the law itself, because of the mandates and whatnot, is driving inaffordability, and so we think that could be changed, and it could be changed, without repeal of the Affordable Care Act. It could be changed through pretty common sense ways.
So that's what Congress can do, some things to help lower the cost. Correct?
Yeah, absolutely. And it's gotten politicized. I think a lot of people are saying all or nothing, right? Repeal, replace, and we get that. We just think politically with the president and the White House. I mean, this is called Obamacare after all, right? He's not going to sign a repeal of the law. So what we've been focused on are what are those kind of incremental policies that we can either repeal or change in the law that would address a problem or make things more affordable. And we've been successful over the past couple of years. We've gotten 4 laws that would repeal or modify the Affordable Care Act that we think address real problems that have been driving up health costs. I'll give you one example.
Yeah, please go ahead.
Yeah. So small employers in the small group market. There was a maximum cap on the deductible that they could offer in a plan, and for an employer, if they're trying to offer a benefit, they can provide their workers and say provide 100% of the premium or 80%, 70% of the premium. Oftentimes that means increasing the deductible a little bit. Well, because of the cap in the small group market, it was $2,000 for an individual policy, $4,000 for a family policy. That was really harming their ability to continue to offer coverage to their workers. So John Boehner and Harry Reid, 8 months before the election, agreed that should be repealed. And so there are bipartisan compromises that we can get changes to the Affordable Care Act, even in election years, that would help employers and individuals better afford their coverage.
So let's. I want to come back to transparency. We've got in wellness in a minute, but I want to ask you to get your perspective. So let's look ahead, and what's the council's position on? Let's say that there's an opportunity to have, an administration and a Congress that is more pro repeal and replace. What's the council's position on that? Is it to, hey, let's try to fix what we have here versus tearing everything up? And what do you advocate for? What's your position on all that?
When the law originally came through, we were neutral on it. We had members who were in favor of it. We were members who were opposed to it.
Right.
Now I think we've got some experience, and in hindsight, we've got plans pulling out. We've got very high premiums. We've got a very relatively sick risk pool. We've got folks who aren't buying coverage unless they have a subsidy. We have folks who, even if they have a subsidy, aren't signing up. That's concerning. And so right now what we're saying is, considering the political polarization, let's see if we can incrementally make changes to make the markets work a little better. Now, if there's a tidal wave shift in the political environment in D.C. this November, in other words, we have a Republican in the White House, there's a Republican Senate, Republican House, I think it is a near certainty that the law will be repealed. Now, what goes in place of it is it gets really tricky, and that's what Speaker Ryan is working on right now with the committees of jurisdiction in the House, to put out a white paper this year and policies next year that would fundamentally change the markets. And we're working on that as well. And I think, you can think everything from the smaller changes if a Democrat continues to be in the White House to big changes if a Republican's in the White House. On the big side, we really think that there ought to be tax policy that makes it neutral to an employer about whether they offer a defined benefit plan or a defined contribution plan. And we think that there ought to be some flexibility in that under the benefit mandates, that if you choose the defined contribution path, you don't have to meet all the maternity coverage and other essential health benefit requirements. Yep. the preventive benefit, the actuarial values, etc. And if you're an individual, just because your employer gives you, let's say, $10,000 to go shop for a plan, you shouldn't lose the uniformity and the protections and the administrative simplification that comes from ERISA. That you could go out and buy a policy, and ERISA would follow the person rather than stuck with the employer.
That makes it a lot of sense. So talk a little bit about, we got about 5 minutes left on this segment, and I want to get, and I think transparency is incredibly important. I mean, most of us in this space, you probably agree, is that we can't have true healthcare consumerism without true transparency. And I think wellness, we look at wellness and see that how it is not some soft thing. It's a very important part of productivity, performance, retention, around really, creating healthier employees and their families. So talk a little bit about what the council is doing with transparency and the wellness.
Yeah, a couple things on transparency. First of all, we need good information on health plan choices, right? Mm-hmm. The exchanges were supposed to be the marketplaces where consumers could use tools to help their decision-making process. Unfortunately, what we see in the public exchanges, and we did a report card on this issue that rated the exchanges. You can find it at clearchoicescampaign.org. The report card basically found that the public exchanges were using technology that was basically available 10, 20 years ago. That there was massively advanced technology in the marketplace that allow people to sort plans by the issues they have, the problems they have, the diseases they have, the drugs they're taking, so that they can actually get a plan that best meets their needs. We're not using those in the public exchanges. We think that's wrong. That ought to be farmed out to the private sector, and we should keep some functions for the government, like eligibility verification, income verification through the IRS. But we're actually leveraging the good technology and the creative marketplace so that people can get good tools to make good plan choices and decisions. Right. Research has shown when someone's aligned with a plan and it's a good fit, costs are about 30% less. So that's kind of first thing on the plan side. On the provider side, though, what we see in the marketplace is hospital costs, physician costs vary substantially across settings for similar procedures, and there's very little information available to support consumer decision making. Now, there's emerging tools, but federal policy more often than not hinders the use of those tools in making decisions rather than helps. And so what we're advocating for is that prices and quality measures, quality performance scores be released to the public. If taxpayers are paying, for example, for Medicare and Medicaid, that information about that hospital or that physician ought to be made public. Now, it ought to be paired side by side with the quality measure because that's a good view of value, right? Cost and quality looks at value. But there's no reason with the amount of data that we have available at a very granular level that we wouldn't be able to empower entrepreneurs to create tools that allow consumers to have a good look at the relative cost of provider A versus provider B.
I mean, so you're working aggressively advocating to get some of these federal policy hurdles down to enable transparency to emerge and true transparency to emerge. Is that correct?
Yeah, I'll give you an example. So in Medicare today, you could go on the Medicare Compare website, and it's almost useless to a consumer to be able to make a comparison between Hospital A and Hospital B. It's a hard-to-use, clunky tool. The information on cost isn't available. Even if the cost were available, it's a Medicare DRG, or if you have the charge, it's not relevant to a consumer. No one pays a charge. No one pays that. The DRG is an administered pricing mechanism established by law. If I'm a private commercial market health consumer, or perhaps I'm uninsured, or perhaps I have a very high deductible, what I want to see is an average amount paid, and then compare that between this hospital and that hospital. In that way, I can make an informed decision. And so we've got legislation we expect to be introduced in the next month or so that would require hospitals to disclose that for the top 50 inpatient and outpatient DRGs and make those available to consumers on public-facing websites.
Okay. And I mean, I see in the free market a lot of emerging decision support tools, and I'm not sure you're seeing the same thing, but I think that, I think the market will create these tools if we can get some of these policies in check to allow this. Now, do you work close with Leah at Leapfrog Group too on what she's doing around safety and transparency with hospitals?
Yeah, I was on a panel with her not too long ago, and she's great. She's doing fantastic work.
Yeah.
That's a big deal, right? Like safety in a hospital is a big, big deal.
It is.
And you want all-cause readmissions. You want mortality rates. You want them by surgical procedures, by disease type, because, if you've got a choice between Hospital A and Hospital B and your mortality rate is 10% lower in Hospital B, you start choosing Hospital B, Hospital A is going to get better at their mortality rate. That's a virtuous cycle. We want to encourage that in the marketplace.
Yep, I agree with you. We got a couple minutes to go here. Give us kind of a quick overview of what you're doing around wellness, please.
On wellness, it's really interesting because there was a big fight during the Affordable Care Act over wellness, and there was, interestingly, a lot of disease groups here in Washington, D.C., those folks representing cancer and heart and diabetes and others, who were lining up against wellness incentives, saying that their folks might be disadvantaged and unable to participate if because they're so sick they wouldn't be able to maybe take advantage of the discounts. So the wellness incentives in the Affordable Care Act were limited strictly to the employer market, and now that we've had a couple years of experience there, I think some of the concerns that were raised by the advocates haven't been borne out. There's still some discrimination issues that I think are more on the labor side, but not on the health side. And so, what we're looking at doing, and again, we're hopeful that a bill will be introduced in the next 2 months before the August recess, is legislation that would allow wellness discounts not just in the employer market, but in the individual market. So right now, if I'm an individual, I'm buying coverage on the exchange or through a commercial insurer off the exchange or on a private exchange, I can't get that discount for participating in a wellness program the way I could if I work for an employer. It's illegal in the individual market. We want to make it legal in the individual market so that folks can get the 30 to 50% discount just as they would if they were working for an IBM or a Verizon.
Yeah, that makes a lot of sense. And particularly what you're talking about, defined contribution, and where you follow it, these individuals, go out and buy individual coverage, things like that. So, Joe, listen, it's been great having you on the program. I'd like to stay close with you and work with you again and maybe have you on the program, get you involved with some of our events. I think you've got a real important mission and message, to help us get, better cost control and cost savings for individuals as well as employers and the stakeholders in the space. And it's been a pleasure having you on. I want to give you a chance, a minute or so, to leave our audience with some final thoughts.
Yeah, I think just the things that we've talked about today could save in the marketplace anywhere between $100 to $200 billion annually. So if we start pursuing aggressively some of these policies and Congress hears our collective voices, we will do more to impact the market and advance consumerism in healthcare than we have in a very long time. And so the great work that you all are doing needs to be amplified. Folks who are listening to the podcast what the folks are going to say down in Atlanta, we need to get revved up and energized about this and engaged in the political process so that our decision makers who are making these laws that oftentimes don't work for folks, make things more expensive and less affordable, we can start to change that dynamic and get on a better track in this country.
Yeah, I look forward to working with you more closely. Go ahead. I'm sorry.
Yeah, so I would just invite folks to go to our websites, CAHC.net and clearchoicescampaign.org. We've got grassroots tools there. We've got lots of materials. Our contact information is there. We're looking forward to partnering with you all and looking forward to Atlanta as well.
Thanks, Joe. Appreciate you having on the program. We'll see you soon in Atlanta, and have a great weekend.
All right. Thanks. You too.